Hi, I'm Dr. Dave Candy, and in this video, I'm going to tell you two very common causes of sharp stabbing pain in your knees and things that you can do about it. Now, if you find this video helpful, give it a like or thumbs up and subscribe to our channel so you get notified of our future videos. Now, the first thing you need to know about sharp stabbing pains in your knee is that they can be caused by various different problems. But the first thing that you need to know is the location of the pain. So if the pain is on the front of the knee, that's caused by one problem. If it's on the inside or the outside of the knee, that's caused by a different problem, but largely those two can be caused by the same problem. So first, if you have pain in the front of your knee, a sharp stabbing pain in the front of your knee, the biggest problems are stiffness in the thigh muscles and then weakness in your butt muscles. So if your thigh muscles are too stiff, then it's going to create pressure on your kneecap and the tendon that attaches down below your knee. Now, there are various different problems like patellar tendonitis or kneecap arthritis or chondromalacia, and all those different terminologies, they're caused by a very similar problem. And that's putting too much stress on the thigh muscle, which can create compression of the kneecap against the thigh bone and cause tension on that patellar tendon. So there are stretches that I have in a different video about how to stretch your thigh muscles and hip flexors. And I'll link to those in a different video. Now, for your hips, if you're going downstairs, for example, or going upstairs, and you're putting too much weight on your toes, that puts a lot of pressure on your thigh muscle, which again can create that sharp stabbing pain underneath your kneecap or just below your kneecap. So when you're doing things like squatting or going up and down stairs, if you focus about keeping more weight on your heel than on your toe, the further back you put the weight on your heel, it transfers more weight to your hip muscles and less weight on your thigh muscles. So that's for the sharp stabbing pain in the front of your knee. Now, what about the sharp stabbing pain that's on the inside of the knee or on the outside of the knee? Those are caused by different problems, such as hamstring tendonitis or Pezanserine bursitis, it's sometimes called, of the tendons that attach right on the inside of the knee. It can also be caused by IT band tendonitis, where it attaches on the outside of the knee. But largely those can be caused by a similar problem of too much of this motion, of your knee going inwards when you're walking, when you're running, when you're going up and down stairs. So if that's the problem that you have, there are two common things that cause that as well. One is actually an ankle issue, that if you don't have enough flexibility in your ankle to be able to get your weight over your toe, then you're going to go around it. Your body's going to do this to get around so it doesn't have to go straight over the top of the ankle. So stretching your calves is one really good thing that you can do for a sharp stabbing pain on either the inside or the outside part of the knee. And again, that's beyond this video. I'll link to a different video that shows you how to do a calf stretch properly. Now, the other problem is weakness in your hip muscles, and largely the muscles that control this inward-outward. The hip abductors and the hip rotators, they're called. And there are various different ways you can do that. The clamshell is one very common exercise, one that's often performed wrong, and I can link to a video of how to do that correctly. But a more functional exercise is either standing and balancing on one leg, trying to keep your pelvis nice and level, and if that's easy, then trying to do a little mini squat where you keep your knee in line with your toe and you don't let your toe go out or your knee go out in front of your toe. So from the front, it looks like this. Everything should be aligned in one line, not going inwards like this. From the side, again, you want to keep your weight more on the heel than on the toe, sitting back onto the heel like that rather than going out over the toe like that. So hopefully you found those tips helpful. And if you did, again, subscribe to our channel so that you can get notified of our future videos. And if you do need further help, feel free to reach out. Thanks and have a great day.